Bless you.
Oh,
Courtney,
thank you.
Courtney, hi. Are you in are you in the right class?
Yeah, last name Jefferson.
Oh,
Yeah, I'm finna fix it real quick. I'm gonna log back out and log back in.
Courtney, Courtney. Oh, oh, from my Monday class. Oh, so you're just coming for the live. Is that right?
I think she logged out for a minute.
Okay.
Good morning.
Hey, hi, Celine.
Hi.
Oh, Courtney, you're from my Monday class.
I'm sorry?
No, I'm talking to Courtney.
Oh,
Yeah, no worries. Courtney, thanks for coming.
Thanks
That's
for
awesome.
having me.
Yeah, that's awesome. I know you had a holiday on Monday, so yeah, that's great. Okay, we are just waiting for one more student. Okay, so you guys have made it to the end of to the somebody need to mute for background noise. Okay. So you guys have made it to the end of week 2. Almost, right? How's everything going? Everybody's situated in their classes? Getting
A little
organized?
bit.
A little bit? Okay. Getting organized for your classes for this term?
Hmm.
Good. Good, good. Does anybody have any questions from week 1, from orientation?
I have a question.
Yep.
Will we be doing the blueprints together as far as filling it in?
Do you mean your concept study, your study guide?
Yeah, I'm sorry. Yeah.
Yeah, yeah. Well, I'm going to be doing those the instructors are going to be doing those during the reviews, working with the students to fill those in. Um, but the reason why you have them way ahead of time, is so that you can be filling it in, kind of like building your own study guide, right?
Mhm.
So, from your readings, from lecture, from your weekly blueprint notes, that's how those study guides are built. So you should be using all 3 resources, okay, to build that study guide. And so hopefully when you come to a review next week or listen to a recording, that you'll have already completed that study guide, and then we'll go through it. Does that make sense?
Okay.
So thank you for asking that question. So it lists out the concepts, the study guide. And then, like I said, through the lecture readings, weekly notes, you should be filling that out. And in the reviews, the plan is to go over all those concepts that are in the study guide, see what you filled out, see what's important, what is the most important information and knowledge that needs to be understood with each of those concepts to understand it.
Okay.
Does that make sense, Courtney?
Yes.
Um, so a couple things on my part. I've posted several announcements in the last 48 hours. If you haven't been keeping up with them, please keep up with them. Does anybody have any questions about the announcements I've posted? I did already post week three's announcement. I meant to delay that posting until tomorrow morning, but it didn't work that way. So you already have week three's announcement for next week with their blueprint notes. All right, so just check your announcements. If you have any questions, let me know. I did send an announcement at PowerPoint. The PowerPoint and blueprint is private. Does that mean the PowerPoint in the module?
The, mm,
Because
I wasn't able to see it.
okay. We had this issue with a student on Monday. So were you going? Who says it's private?
It's me, Ranjana.
Okay.
I can try, but I don't think it let me. It says
Yeah.
access denied.
Try it through the module.
Hmm.
Okay. Was anybody else able to look at the PowerPoints from this week? Simone saying yes.
Check.
And Simone, I'm assuming you went through the module to access those rather than the book. Right. Try that. Try whoever, if you could try that through the module. Try the opening the PowerPoint through the module.
Oh, okay, I see it.
You see it now?
Hmm.
Good. I did send a message last evening about ExamSoft. Everybody saw that? You do need to go in and take that practice test. Okay, to make sure everything's lining up. Okay, so if you haven't seen that, go into ExamSoft or read the announcement, then go into ExamSoft, do the practice test. Okay. So we're going to start out today with doing quiz 1. Okay, then we're going to review the contents for the concepts in weeks 1 and 2. Okay, and that will take us through the rest of the class this week since we have 2 weeks to cover. Okay. Anybody have any questions? Okay, everybody's quiz should be preloaded in your module. Quiz 1. You're welcome to open that. You got to stay on camera while you take the quiz. Okay, you can open that and start that. It's 9:07, so we'll take till 10:25. We'll take about 15 minutes to complete that. When you complete the quiz, please hit submit. And then after we all finish the quiz, we'll review the quiz. Okay. Is everybody able to access it through their module? Okay, great. All right, I'm going to mute myself and mute whoever's not muted. So take the quiz, stay on camera, and then we'll talk about it here in a bit. Okay. You still working on it?
Yeah, what was it? I'm almost done.
Okay, all right, let me know when you're done.
I'm done.
Okay. Thank you. Okay. Everybody's done. How'd you do?
Okay.
All right. So let's take a look at the quiz. We'll do some content from the quiz. I always like reviewing quizzes because we can see what answer's right, what's wrong, and why is it wrong or why is it right. I think reviewing these quizzes is a good teaching and learning exercise as well. Okay. So let me share my screen and we'll go to the quiz. Can everybody see this? Yes? No?
Yes.
Yes. Okay, great. Okay. So one of the concepts that was in week one was look, introduction to community nursing. So this question comes from that section. Okay. What is example of community-oriented nursing? So before we answer that question, one of the things that we need to understand, and we'll go through this when we do our content in a little bit, but the difference between community-oriented nursing and community-based nursing. Who wants to take a stab at that? What's the difference? There's a big difference. What did you learn from your readings and your notes?
Isn't based more focused on an individual
Mhm.
and then oriented is more focused on the entire community?
Exactly right, Megan. That's exactly right. Right? So based on what Megan just said, okay, what's the correct answer to this question?
The illness or evaluating outcomes of community vaccination program.
Right? That's the correct answer. Why is that the correct answer? Because it's looking at a community-wide based program. Right? So Megan shared the difference. The way I remember it is I think community oriented is the big picture. You're trying to get oriented to the whole community. Right? We'll talk about this more in content, but community oriented is the big picture. Community based simply means, as Megan alluded to, you're based in the community. You're working you're working in the community. Right? You might be a school nurse, you might be a hospice nurse, you might be a home health nurse, you might be an occupational nurse. Right? You're based in the community, taking care of clients in the community. So the rest of these answers are all community based. Illness care of individuals in the community. That is the true definition of community based. Illness care of individuals in the community. You're community based. Why would B be community based? Educating a child and school teacher on the use of an inhaler. Why would that be community based?
It's the individual.
Mm-hmm. It's in the community. You're based in the community. It can be a school, right? You're taking care of kids in the school. So that's why that's based. And then what about D? Home health care delivered in the community. Everybody understand why that's community based. You're taking care of clients in the community. Okay? Give me another example. Give me some examples of community-oriented practice. Just think out loud.
Running a health clinic, like doing like health screening, like coming in for like scoliosis checks or hearing checks and stuff like that as a community.
Yep.
Like being open to the community.
Yeah, perfect. Anybody else have any other examples? Excellent example. Okay, let's move on to question 2. So question 2, again, came from week 1 concepts. There's a whole section in your notes that identifies, that has all of these in here, right? In your Healthy People 2030 section. So what describes the purpose of Healthy People 2030 campaign? Select all that apply. We know A is correct. It provides the framework to improve the health of all Americans. Remember, if you got on the website and looked at Healthy People 2030, it is a national initiative. So any answers that are talking about all Americans, national initiative would be correct. So it improves the framework, it provides a framework to improve the health of all Americans. That is true. What's also true is B, attain healthy, thriving lives and well-being, free of preventable diseases, disability, injury, and premature death. Because that is another objective. Okay, the other correct answer is D, promote healthy development, healthy behaviors, and well-being across all life stages. Okay, what it doesn't address and has nothing to do with is C. It has nothing to do with creating any kind of a curriculum, nursing curriculum. Okay, this isn't about nursing. This is about the health of all. Okay, so that came right from your week 1 notes, that question. Okay, we'll talk when we get to our content about levels of prevention, primary, secondary, tertiary. We'll talk more in depth when we do the content piece. What's the difference from what you've read? What did you learn? What is primary?
Prevention.
Okay, P for P, primary prevention. What's secondary?
Screening.
Screening, excellent. S for secondary, S for screening. This is how I remember it. What's tertiary?
Treating.
Management.
Treatment, management, treatment. So T for tertiary, T for treatment. Okay, so looking at this question, what's an example of primary prevention?
The first
Prevention
one.
of the problem before it even occurs.
Correct. That's what prevention is, preventing something before it happens, preventing an injury, preventing illness, condition, disease, diagnosis, preventing something before it happens. What would B be?
Secondary.
Secondary.
Yeah, screening. What would C be?
Territory.
Tertiary. Right? You always remember with tertiary, you have to have something. Right? So you managing a disease. Okay? And then what is B? Or excuse me, D.
Secondary.
Secondary. Yep. Early identification, the screening, you're screening for risk. So you're screening early identification so that you can do early intervention to prevent something from moving into a tertiary phase. Okay. Okay, question 4 is in week 2. Question 4 is from week 1 with your introduction to vulnerability. So what's the right answer here? Remember, the question is a...
year old with tuberculosis.
Okay. Okay, we know that teen pregnancy is considered a vulnerable population. Okay, if that had said what if that had said a 26-year-old? Would that be considered a vulnerable population?
No.
No. Okay, so the age here. Okay, so we know that's teen pregnancy. We know that veterans are considered a vulnerable population. We know that substance abusers are considered a vulnerable population. Okay. D is not considered a vulnerable population. Yes, it's a serious disease and condition, but that person is not considered part of a larger vulnerable population.
Can you explain that a little more? Because what I like went between that one and the substance abuse because I thought a vulnerable population had to do with diseases. So why is she not?
Well, vulnerable population is a group of people.
Right.
So teen pregnancy, veterans, substance abusers. Somebody with tuberculosis, yes, is considered a vulnerable individual for what they have, but overall, that is not considered a vulnerable population. Now, you could say that the homeless who are at high risk for TB, right? Homeless is a vulnerable population. But the single individual is not considered a population.
Okay.
Make sense?
Kinda. I think I'm just reading into it too much.
You'll get lectures from me about that through the term of overthinking. Okay, question 5. So if which of the following are considered nursing interventions in caring for vulnerable populations? Select all that apply. Okay, so what do vulnerable populations need? What's the correct answer? Answers.
All of them.
An increase in resources.
All of them are correct answers.
Hmm.
Right? So they need increased resources. We want to try and help them reduce health risks. We certainly want to assess the amount of stress for the individual and the family because that's going to help direct our strategy, right, for what they need. And we certainly want to reduce health disparities. Okay, vulnerable populations have a lot of risks, have a lot of issues, have a lot of risks. There's so much we need to do for them. Okay, so all those answers were correct. And again, that came from your week 1 notes. Okay, resiliency. First, let's identify what the term resiliency means. What does resiliency mean?
Not to give up.
Mm-hmm. Keep moving forward. All right, keep trying to overcome whatever's going on. Keep fighting through it. Okay, and resiliency, somebody asked me this, but resiliency, just so you know, there was a whole paragraph in your notes in your week 1 notes about resiliency. Okay. When we think about resiliency, that is something we want to help. We'll go through this in the notes, but we want to help vulnerable populations become more resilient, right? Because the more resilient you can be, the better chance you have at overcoming risks, right? So based on that, what's the correct answer?
B.
And why is B the correct answer?
Because we're less vulnerable when we're being resilient.
Exactly right. And actually, A, it's the opposite. Okay, resiliency decreases the risk that somebody will get sick. Okay. Resiliency does not solely depend on genetic predisposition, and resiliency cannot be learned if the client doesn't possess it. Yes, it can be learned. So that's incorrect. Okay. This is question 7 comes from part of the Healthy People 2030 identifies the 5 functions of a family. And that is in your, I believe your week 2 notes under family nursing, family health risks. Okay, so what's the correct answer here?
It's education, but I have a question about that.
Mm-hmm. Sure.
Why is it not considered
I
one of the
know.
5 functions?
I know.
Because do you know how much teaching I do in this house to be told that we
I
don't do
know.
education?
I know. I know. I've thought about that before. Right. Right.
I mean, I chose that answer just based off of like priorities in my house.
Mhm,
Like
mhm, mhm.
reproductive, you wouldn't have a family without that. Financials are obviously a big part of
Mhm,
it, and I
mhm.
want to socialize with my family, but education.
I know. So really, this topic of 5, we'll cover this when we do the content. But these 5, it is financial, health is not in there, but financial, health, reproductive, socialization is one, and the last one is effective. These are what Healthy People 2030 identifies as the 5 basic functions of the family. There are more, Megan, I agree. You could list lots of different functions of the family, but these are the 5 primary functions they come up with and how they determine, not how they, but how a family is looked at to assess, is this a functioning family? Is this a dysfunctioning family? So
I would argue that without education, one's family would be dysfunctional. So that's where it doesn't make sense to me.
well, let me go back into the notes because we'll get to that. But education, health, in the health section, they talk about teaching healthy behaviors, teaching health maintenance, providing caregiving. So you could probably slide education into that, right? With your teaching healthy behaviors. The socialization piece, I'm just reading from our notes here, raising children to fit into society, become productive, responsible, well-adjusted adults. That's education, that's teaching, right? I know. I know what you're saying. I'm effective, creating a sense of identity, belonging through affection, love, time together, bonding. So I think that teaching / education comes up in several of these functions. It's just not called education. I hear where you're coming from. I hear where you're coming from. Okay, question 8. Okay, this is a school nurse question. So this is, week 2. Okay, so the school nurse is practicing tertiary. All right, what's she doing? Tertiary. What's she doing?
Giving medicine.
Administering medication.
Yeah, because they're giving medication because some kid has something, right? Whether they have a cold, whether they have ADHD, whether they have asthma and they need an inhaler, whether they've had an allergic reaction and they need their EpiPen. Okay, they have something. That's always tertiary. What is B? Primary, secondary, tertiary?
Primary.
Why?
It's a prevention, good hygiene, hand
Yeah.
hygiene.
Prevention. And then C and D, What are those? They're screenings.
Secondary.
Yeah, they're screenings. Okay. Question 9, which would not be considered an appropriate intervention for a student with ADHD? This came from your notes. This is one of the common childhood ailments. Okay, so this came from your notes in week 2 with regards to ADHD. So what are we thinking what would not be considered an appropriate intervention?
Standards, reliable.
The one-on-one.
Okay, and why is that?
Because they need to run around, get some of that energy out.
Okay, some students, I need to let the student in here. Hang on a second. That's correct. Some students with ADHD may need a one-on-one, right? But the blanket statement of all students with ADHD need a one-on-one, that's not right. Some may.
Yeah, I picked that one, but I second guessed myself.
I chose that one, and it says for a student with ADHD. And I chose it because I am a student that had ADHD and I had a one-on-one, and I chose to not place a child in the front of the classroom because,
Yeah.
like the other girl said, we do need room to run around and express ourselves and fidget and stuff like that. So it would be a distraction, if anything, to put that child in the front of the classroom. You would assign them a one-on-one and allow them that time to run around. So I'm confused about that.
Okay,
Because
so
it's not a blanket statement question. It says for a student.
assign an aide to work with the student one-on-one. This is what you would not do. What this is assuming that everybody assign an aide to work with the student. That's not necessarily true for all students. All students with ADHD don't need a one-to-one aide. The thought of placing the child in the classroom, if you look at your notes, it's not punitive. It's to help with the symptoms of ADHD, which is focus and attention. So it's not pure, they're not being put in the front of the classroom because they're bad. They're being put in the front of the classroom to help with the focusing. Does that make sense?
No, I'm reading too far into it because I've experienced it. So
Okay.
I can't agree with it.
Okay.
I
Well,
think I understand it.
D makes the assumption that you're assigning an aide to work with the student. That
Right.
isn't always, but that's a blanket statement. So the assumption is that all kids with ADHD need a one-to-one aide. And that's not true. Far from true, actually.
Yeah, because I had
Agreed.
ADHD, but I didn't
But
need
it's not
one-on-one.
It says a student. It doesn't say for a population of students with ADHD or for all students with ADHD. It says for a student, so it would be an
Assigning, I think,
appropriate for an individual.
Megan, I think you're reading way too much into the question. Where does it say assign? You're saying a student. Where are you seeing that?
It says which would not be considered an appropriate intervention for a student with ADHD. It doesn't say for so the way I looked at it is for an individual, like one kid, it could make sense and it could be appropriate for one child. I wasn't trying to say it was appropriate for all ADHD students.
Okay.
So that's what I was saying. Like for that question, it
Okay.
isn't a blanket. It's not umbrella statement there. So that's why I didn't see it as like inappropriate necessarily.
Okay, that's fair. I explained the assumptions of A and D.
Right.
It's talking about students with ADHD as a whole. Yes, might it help them to place them in front of the classroom? Maybe. But that's one of the interventions we would try. Assign them to work with a one-to-one.
I was confused as well with this one. I put limited outdoor physical activity because it's for me not be considered appropriate because it's not help to relaxing the energy they have
Mhm.
and improve
So-
focus.
Okay, but Celine, look at the question. We're asking, it's a negative question. What is not considered? Not considered appropriate intervention. This is correct. Do not limit outdoor activity as a punishment. Yeah, we don't want to do that. So that's a correct answer. It's asking for what would you not do? Does that make sense?
I got it.
What would you not do? So you would not automatically assign an aide to work with the student one-on-one. But all the other three are good interventions, right? They're good. But the question is asking, what should you not do? Does that make sense?
Yes, I got it.
Does that make sense? So A, B, and C are all okay. D, for purposes of this question, is not okay. But not to make the assumption that everybody needs a one-to-one. Okay, Celine, does that make sense?
Yes, I got it.
Yeah, okay. Question 10. Okay, conjunctivitis, another common childhood ailment. Which statement is true with regards to acute conjunctivitis? Select all that apply. What do we know about conjunctivitis? We know that A
It's
is
also
correct.
called pink
Oh,
eye.
go ahead.
I
Yep,
said that
so,
it was also called pink eye, so that would
yep,
be
so
one.
A is correct. Yep, yep. C is correct.
D.
And D is correct. Okay, B is incorrect. All right, so A, C, and D are the correct answers. B is incorrect because we do typically treat, right, with antibiotic drops. Okay, and again, this came from your notes in week 2 with your common childhood ailments. Okay. Questions about the quiz? Do you find it helpful to go over it?
I just feel like I'm overthinking it. But yeah,
Okay.
a lot.
Simone, come on. I'm gonna get on you guys for overthinking. Here's a good rule of thumb, you guys. Just gonna pull us all back in here. Here's a good rule of thumb. If the information is not in the question that you're thinking about, that's running around your head, it doesn't exist. Does that make sense? And this goes for quizzes and exam questions. If you're starting to put a lot of extra information into that question that's not actually in there, you're just thinking about it, don't do that. Okay? So one of the test taking strategies, rules of thumb, the information's not in the question, it doesn't exist. Okay? That's one rule of overthinking. Simone, does that make sense? Overthinking is really, we'll send you down some rabbit holes that that will hurt you during exams. Anybody else have any strategies for overthinking?
Don't second guess yourself.
Do not second guess yourself. Thank you, Hannah. Here's another rule of thumb. If you are thinking about changing your answer, it's one thing if you went too quickly and accidentally selected the wrong answer. I get that. Go back and select the correct answer. But if you have originally selected an answer, you need to be absolutely 100% convinced of why you picked the wrong answer and why you need to change it. It can't be, oh, I think I remember her saying that. Oh, I think I read that somewhere. No, that's not concrete. You must be able to convince yourself without any doubt of why you're changing your answer. Hannah, does that make sense?
Yeah.
Yep. So that's another rule of thumb. Okay. Okay. Let me share my screen and we'll take a look at we'll go through the content. And some of this we've already covered going through the quiz, which is why I like to go through the quiz as well. All right. So weeks 1 and 2. So you had some quiz questions, I think one about introduction to community, levels of healthcare, Healthy People 2030, and introduction to vulnerability. You'll see these notes every week where I copy and paste the concepts at the top, and then I copy and paste from the syllabus the readings. Okay. And I went through in week 1, we all know where to find, if it says C Canvas course readings, you know where to find those, right? They're built right into your weekly module. Right? So, introduction to community nursing. So we talked about the difference between community-oriented, community-based. Okay? Illness care so let's read through it. All right? Community-oriented focuses around the community or population. Right? Primarily focusing on health promotion rather than illness care. That's one significant difference. And the second one is the whole group, the community versus the individual. Right? We talked about some of the roles of community-based nursing. I just retired from school nursing. I was considered a community-based nurse since I was a school nurse. We talked about home health nurses being community-based, hospice nurses being community-based, maybe occupational health nurses being community-based. Okay? So individuals as opposed to communities. Okay? Levels of prevention. We start to talk about that with one of the questions. This is a great summary of levels of prevention. Okay? P primary before it even occurs. So some examples: prevention of illness, prevention of injury. Maybe in the schools, prevention, we worked with the younger kids for bike safety with wearing helmets. We work with adolescents who are learning to drive and seatbelt safety. Okay, we talked about prevention of substance abuse, prevention of smoking, prevention of teaching about obesity, the risks of obesity, the risks of substance abuse, the risks, talking about suicide. Those are all prevention, and I'm bringing up my examples from the school. Okay, so secondary, early identification, and early intervention. The earlier we can detect something, the more we can work with it, try and prevent complications. It's really an attempt to reverse the course. Okay, so that's where all your screenings come in. Right? In the schools, we used to do risks for obesity. Who's at risk for obesity? Who's at risk for maybe an unintended pregnancy? Who's at risk for substance abuse? Who's at risk for depression or mental health illnesses? Screening, so that we can get to these kids before something happens. So tertiary is treatment, right? Or management of a disease to reduce the symptoms. Maybe we're trying to just simply improve the quality of life. Maybe we're teaching about a low sodium diet with clients with hypertension. Maybe we're working with diabetic. I could tell you in the schools, working with newly diagnosed diabetic kids, how to check your blood sugar, how to give yourself an insulin injection. Okay, they have to have something. Okay? We talked about Healthy People 2030 and all their goals, right? That's a nationally driven agenda for everybody. Improve the health and well-being over the next decade. And believe it or not, we started with Healthy People to 2000, then we went to 2010. And if you have been on their website, you saw all this. 2000, 2010, 2020, and now we have 2030. So these are national objectives over the next decade. One of the areas that Healthy People 2030 addresses, they all do, but social determinants of health. I want to address that. Okay. Social determinants of health affect the current status of our health and well-being. Right? These are things in the environment, such as where are we born? Where do we currently live? Where are we educated, or where are kids educated? Where do we work? Where do we do for social things? Where do we worship? Age. All these things will affect the quality of life, your outcomes, and your risks. Okay, so there's 5 social determinants of health that Healthy People Initiative talk about. They talk about remembering community. We can be talking about an individual, a family, or a group in the community, right? So think about these social determinants of health when you think about who is our client. Are we working with an individual? Are we working with a family? Are we working with the elderly? Or are we working with the whole community? So economic stability plays a huge role. Education access and quality, healthcare access and quality, what your community looks like, what does your neighborhood environment look like? And then social. Okay. So those are the 5, that's what Healthy People determines to be the 5 social, right? When we say social, we say environment. Okay. So we know that social determinants of health have a major impact. They have a major impact on our health, our well-being, and our quality of life. And here's some examples. Safe housing. Do you have safe housing? Is there transportation in the neighborhoods? What does racism, discrimination, and violence look like? Do you live in a community that has a lot of violence? Do you live in a community that has gangs? Do you live in a community that has a large immigrant population? Do you live in a community where there's a lot of non-English speaking people? What's the education like? Are you in underperforming schools? What's the access to education? Do you have the opportunity to send your kids elsewhere? And job opportunities. What's the employment rate in your community? Is there a high unemployment rate? A lot of people not working? What's the average income? Is your community a community that primarily is comprised of people that live in poverty? What kind of access to nutritional foods and physical activity opportunities does your community have? Are there rec centers? Are there parks? Are there trails or places where you can get out, get some exercise? Is it a community that has grocery stores, big chain grocery stores where you have access to lots of different things? Or are you in a community that has smaller stores that may have less access to nutritional foods? What about polluted air and water? Do you live in a community that maybe is near a transportation hub, right? That may have less quality air, water, live near a stream, river, where the potential of contamination, right? Language and literacy skills we addressed. Do you live in a community that has a large non-English speaking population? How do they gain access to the services in the community? if they don't understand what the resources are. So you can see that these social determinants of health, think about it. If you think about these things we just talked about, and individuals or families or the elderly in a particular community don't have a lot of access to this, they're at risk. They become much more at risk, right? If the youth don't have, I don't know, let's say, programs for them, after school programs, whatever, does that put them more at risk of getting into trouble? So we know that social determinants of health can contribute to a wide variety of health disparities and inequities. And we talked about, for example, people who have access to grocery stores with healthy foods are less likely to have good nutrition. What may that lead to? Right? If they don't have access to healthy foods, maybe their risks go up for chronic conditions like heart disease, diabetes, obesity. Right? So just promoting healthy choices simply won't eliminate these and the other disparities that we just talked about. So what we need is community health, public health organizations, community partners, like education, the education leaders in the community, the transportation leaders, the housing leaders, religious leaders. Everybody in the community needs to come together, and they usually do, working towards improving the conditions for these social determinants of health for the community. Does that make sense? Questions about that? Because social determinants of health, these 5 things, really do affect the health and functioning of individuals, families, groups of people in a community, and the whole community. They really do. I mean, think about the community you live in now. Think about your own zip code. Think about what goes on with regards to these 5 social determinants of health. You can probably articulate how healthy and strong your community is or isn't. Right? So we don't tend to think about this. This is one of my examples of taking off your hospital hat. Right? You are now in the community. You're now responsible for looking at your community as a whole. There are many similar needs to working in the hospital setting, but it's also a whole different way of looking at healthcare when you're in the community, right? There's so many more things to consider. Okay. Introduction to vulnerability. So we talked about some of the different vulnerable populations. Okay. Why are kids vulnerable? Why are kids vulnerable?
They can't
Because they
express
can't
themselves.
advocate.
Can't advocate, right? Why else?
They can't explain what's going on with them necessarily.
Mhm.
Sometimes they don't know how to explain what's going on.
Exactly. Good, good. Anything else? Elderly. Why are they considered vulnerable?
They're weak.
A lot of you guys did your discussion one question on the elderly. Go ahead. Why are they vulnerable?
Sometimes mental capacity slips, like dementia and Alzheimer's. When you get
Mhm.
older, you can't make the decisions you need to make for yourself.
Mm-hmm. What else about the elderly? The elderly are going to have a lot of chronic diseases. Okay, that automatically puts,
Comorbidity.
yeah, comorbidities, and it's automatically going to put them into a vulnerable population. Some other vulnerable populations are chronically ill. Any age, but you're chronically ill, right? Chronically ill are very at risk for poor health outcomes. Okay, your American non-English speakers, very vulnerable, right? How do they understand the system? How do they understand the education system, the healthcare system, how to access physicians, how to access physicians for their kids? You know, the non-English speaking population really becomes at risk because they simply can't navigate. They can't navigate what's going on in the community. Okay. Resilience. Here's our part on resilience, which we've talked about. Okay. The other part about resiliency we didn't talk about is how resiliency is influenced by early life experiences, right? And the thought is that negative events that do occur in childhood that aren't dealt with, however, therapy, counseling, could potentially decrease resiliency, right? With resiliency, you want higher levels of confidence, right? Higher levels of control that you feel in your own life. This assists in better decision making. Okay. The other word that comes up when we talk about community nursing or communities is disenfranchisement. Now, there's a lot of vulnerable populations, and this is a section we're in, Introduction to Vulnerability. There's a lot of vulnerable populations that feel disenfranchised. What does that mean? They're outside the bubble, right? Feel forgotten, feel unimportant, feel unseen, not involved, right? It's really a separation. It's a separation from the community. Okay. Certain particular vulnerable groups like the poor, the homeless, the migrant workers may feel invisible to the rest of us and tend to be forgotten. Okay. Poverty and low education levels, right? They are definitely going to contribute to social conditions in which you're going to see disparities. If you're living in poverty, you have low educational levels, the disparities are going to be much more visible, right? Some examples. The poor often live in unsafe areas. They may work in stressful environments, have less access to healthy foods or exercise or health care. The poor are typically either uninsured or underinsured. All right. So if they're uninsured, underinsured, they're much less likely to seek out preventative care services. All right. Much higher risks. We talked about social determinants of health. This is important. You're going to be asked about this on the exam, first exam. Poverty is considered the primary cause of vulnerability. Think about it. If you're living in poverty, think about all the different aspects that affects. Right? Crowded living conditions, employment, nutrition, risks for substance abuse and mental health issues, chronic stress. Okay. More at risk for communicable infectious diseases, trauma, Okay, so poverty affects everything. Right? We know that higher levels of education plays a role. Obviously, higher levels of education lead to better choices. Right? Higher education increases self-confidence, increases resiliency. So when we go and talk about our teen pregnant vulnerable population, one of the things you'll learn is one of the most important interventions we can do for this group is keeping them in school. Right? Keeping a teen pregnant in school during the pregnancy and after the baby is here, well, it is one of the most positive interventions we can do for them. You know, if they can continue on with their education, they may make better life choices for themselves and the babies. So I just bring that up. We'll talk about that. I think next week we'll talk about that, but I just wanted to bring that up. So we know that what else? Veterans are vulnerable. So outcomes of vulnerability. Without intervention, you're likely to have a lower health status or be less healthy, at risk for increased morbidity and mortality, likely to have a high prevalence of chronic illnesses, much more at risk to levels to communicable infectious diseases, TB, hepatitis, STDs. Okay. And then this is good. I want to move on to week 2, but I want you to read this if you already haven't, it's part of your reading, but read through the interventions in care of vulnerable populations. Okay, this was that question where all the answers were correct. What do they need? What can we do for them? This is where that question came from, this section. But there's a few I highlighted at the bottom I just wanted to speak about. Vulnerable people have lots of issues. What we can do as nurses, there's a lot we can do, but showing respect, compassion, and concern. Okay, non-judgmental, not making assumptions, letting whichever vulnerable population you're working with, veterans, homeless, letting them tell their story. They want to tell their story. Okay. One of the most important things to remember about working with vulnerable populations, first and foremost, you've got to establish a trusting relationship. They have to be able to trust you to be in that. That goes without saying in nursing, but it's much more prevalent in the vulnerable populations. Trust, trust, trust. Okay. I mean, we pretty much talk about vulnerable populations throughout a good part of this class, the whole term. You think about your community where you live in. Lots of vulnerable populations, right? Lots of elderly, lots of kids, a lot of homelessness, people with substance abuse issues, people with mental health issues, veterans. Our communities are full of vulnerable populations. All right, let's change course here, talk about some of our week 2 content. School nurse, growth and development, your common childhood ailments, which was your discussion question. Family nursing, family health risks. Here's all your, and I think I explained this in week 1. So for example, this is a good example. All these common childhood ailments. Okay. You're not responsible for the whole chapter. You're responsible for just the pages that's listed, right? That's why you don't have PowerPoints for all these chapters. You only have PowerPoints for the whole chapters that are assigned, right? Which is chapter 11 and 12. That's why I have the PowerPoints. You don't have all the PowerPoints up here because it's not a full chapter. Okay. That question came up this week. That's why I wanted to. And then you have 2 Canvas course reading pages that are they're embedded into your module in week 2. School nurse is my expertise. Spent over 20 years in the schools. So school nurse is considered one of the roles of a community nurse, right? The school nurses work, he or she is community based. They're working in the community, right? So what does the school nurse do? A lot. You know, the days of going to the clinics to get Band-Aids and hugs, long gone for the school nurse, right? Long gone. I can tell you these are some roles that we play. I can tell you as a direct caregiver, by the time I retired a few years ago, school nurse, catheterizations, male and female, caring for diabetic students, insulin pumps, insulin injections, seizure medications, emergency seizure medications, inhalers, EpiPens, trach care, replacing trachs, suctioning. Pretty much do everything now. Okay. School nursing involves a lot of health education. You're working with the students, you're working with the parents, you're working with the teachers, the administrators. You're always educating. Maybe you're working with the teachers on what's asthma, who has an EpiPen, how to use an EpiPen, how to avoid peanuts in your classroom. Tons of education. Working with, there are days I'd start out in the preschool talking about good hand washing and finish up in the high schools with substance abuse prevention. So school nurse does a lot of health education, right? Consultant, providing health information to teachers, school administrations. What health issues do you have in your school? Here's a list. They need to be aware of that. Case manager, we'll talk about case management later in the term, but case management is simply the coordination of care. A case manager coordinates care. So as nurses in the schools, we work as case managers. If you have example of students in special ed, okay, that may have individual education plans, IEPs, they may require services during the school day, physical therapy, occupational therapy, speech, whatever. Okay, that school nurse helps coordinate all those services. So she is the coordinator of care. And then we're always working in the community. Okay, the school nurse has lots of resources in the community for families in need, right? Participating in health fairs, maybe developing we had vaccination days, immunization days. So we're always working out in the community, seeking community partners to help us in the school setting. And then this is an excellent list. Primary, this is specific to the school nurse, primary, secondary, tertiary. And remember that each different topic or concept we're covering, primary, secondary, tertiary, are going to look different, right? The primary preventions for a school nurse are a whole lot different than primary preventions for a hospice nurse, right? So this is a good example of primary prevention in the school setting. So what are we trying to do here? Prevent injuries. I'm not going to go through all this, but you can read through this, just give you a few examples. Providing education to prevent injuries, seatbelts, helmets, playground safety, sports-related injuries. Trying to prevent the prevention of substance abuse behaviors, education on early effects, right? Education on how to reduce your risk, improving awareness for everybody, kids, parents, teachers. Another primary prevention in the schools is reduce the risk of disease by encouraging immunization compliance. Okay, we get into secondary. What do we do in the schools for secondary? Right, we're screening for obesity, allergies, asthma, maybe ADHD. We're screening for scoliosis. Maybe we're doing BMIs. Okay, the one thing I want to point out with secondary, you're screening for risk. Okay, so let's say a student comes in, we know it's common to come in with headaches, stomach aches, fever, sore throat. But we also have to keep in mind bullying and abusive behavior. You know, an example, let's say you have a student that comes in complaining of stomach aches for the last month. They come in at the same time every day. They just want to hang out and they're not interested in going a third or fourth period, whatever the time frame is. We have to be able to take that one step further and assess risk. Okay, because after a month, we know it's not a stomach ache, right? So early intervention, what's going on? What's going on that's causing you to come to the clinic every day at the same time? We know it's not a stomach ache anymore. What is it? So my point is, with secondary, we're trying to identify risk that may be going on. It's not a stomach ache. What else is it? Okay. And then tertiary, this is caring for the ill child, whether it's giving medication, whether it's catheterization in the school setting twice a day during the school day. Okay, we're trying to teach the staff, help the students, if applicable, to help manage their chronic illnesses. Maybe asthma kids, working with them on how they take their inhaler during the school day. When should they come to the clinic? You know, same with kids with allergies, avoiding the foods that will cause them anaphylaxis. Okay. And then this last one here, working with pregnant adolescents. You are going to have pregnant teens in high schools. You're going to. So how do we make sure that we help them, we provide them and work with them with the resources to have a healthy pregnancy in a healthy school environment? Okay. Family and nursing risks. Okay, here's where your 5 functions of a family come up. What is a family? What is a family? What's a family these days? Is there a particular definition? Anything, right? Whatever a family says, whatever they say it is. Typically, whoever is providing physical, emotional, financial support, that's their family, right? The non-traditional families are not the norm now. We know that, right? So here, your 5 functions, we just went through this. So these will affect this looks different with every family. Financial. Are families planning for their future? Are they making good financial decisions? Are they providing house, a roof over the head? Yes or no? Health. Do families, are they teaching, are parents teaching, or guardians or whomever is in the family? Are they teaching healthy behaviors, teaching health maintenances, providing caregiving? Yes or no? Same with reproduction. Whatever the family chooses, however many kids they're going to have. You know, can they take care of that? Do they have the resources to care for the kids in the family? Socialization, raising children to fit into society. We already talked about this. To become productive, responsible, well-adjusted adults. Is that happening or is it not happening? And then that affective function talks about creating a sense of identity, belonging through affection, through love, spending time together, bonding. Is that happening or is that not happening? Right? Because failure to meet these functions leads to dysfunction. So you're either doing these well as a functioning family or you're not doing these well and it's considered dysfunction. Right? Some of the strong contributing factors to all of this that may determine whether it's functional or non-functional, maybe substance abuse, history of substance abuse, violence in the family, anxiety, depression. Do you have a job? Employment. So many things play into these 5 functions of you know, as a community nurse, you will do family assessments. And this is how we look at families. How are they handling all these different functions? Okay. We know that with family health risks, okay, so when disease develops, okay, or over the course of time, it can be 3 different factors: genetic, environment, and behavior. Okay, when we're doing our family assessment, we have to consider all 3. What's environment? We've talked about this repeatedly today. Where do you live? What does your community look like? High crime, pollution, living conditions, employment, poverty, high stress environments. Okay, that's a factor. Going back up to genetics, are you predisposed to anything? Do you have a family history of cancer, of alcoholism, or of heart disease, of asthma? Okay, so what are you genetically exposed to? Environment, what does your environment look like? And then behavior is simply our choices. What choices are we making? Are we making choices to eat healthy, not be obese, not have substance abuse issues, dealing with mental health issues as they come up? Okay, so genetic, environmental, and behavioral. Okay. Then the last section was our common childhood ailments, which hopefully you've read through. We're not going to go through these because it's 9:30 and I don't want to keep you guys over. You guys can read through these on your own, but these are the most common childhood ailments. And as far as the bullets that go with each of them, these are the most important things to know about each of the common childhood ailments to understand that concept. Okay, there's several questions on exam 1 about common childhood ailments. Okay, so please make sure you have a good understanding of what these are. And I think I put 3 of them in the quiz. Okay, we talked about conjunctivitis. I think we talked about asthma, and I think we talked about 1 more of them. And plus, you had your discussion question. So you've already picked 3 of them and done your research on those. Okay, but there's several questions about common childhood ailments on the exam. So please make sure you know those. So we covered a lot today. We covered 2 weeks of content. Do you have a better understanding of some of these concepts, having gone through them? I know it's long to listen to me, but the weeks we have to cover 2 weeks, we're kind of limited in activities. We did the quiz at the beginning of the class. Okay. Next week, when we just have week 3 to cover, we're going to do a case study. We're going to do a migrant health case study, and that's explained in your announcements. So we'll break out after we do the content next week and do a case study and do an activity, so you don't have to listen to me and I don't have to listen to myself. So, questions?
Is there a quiz next week?
Yep.
Okay, and it's
Yeah.
on the
Just week 3.
readings for week 3.
Just
Okay.
week 3. And I sent you out a pretty detailed announcement yesterday that gave you all the weekly notes, which I hope was helpful. And then I listed out each quiz, the week it's given, and the content it's covering. So this quiz today covered week 1 and 2 because last week we had orientation. Next week is week 3. It only covers week 3. So take a look at that. Simone, take a look at that announcement. It explains all of the quizzes, I mean, it's in your module when they are, but it does explain all the weeks that they are. Okay. Questions about today? I know we covered a lot. No questions? All right. So if anybody wants to stay on, has any
I have a
particular
question.
questions? Yep. Courtney, is this something that will benefit the whole group, or should we let the group go since it's 9:30? Your
They
call.
can go if they want.
Okay,
I don't
so
know.
Courtney's going to stay on. I'm going to excuse everybody else. I hope you guys have a really good weekend, and then please reach out if you need anything. I know you're going to stay on as well. Okay, bye.
So I just wanted to know